Good morning. Thank you so much for staying with us right here on Your Women Radio WFM 91.7. This is Nigeria's first radio station for women and their families. And of course, it's about 6 minutes after 10 on the side of the radio. It's a Friday morning. I hope that your Friday morning is going on well. And, you're planning to have a great weekend. And for those who would say, oh, till weekend before our exercise. Oh, yeah, the weekend don't come. How far? How markets? I hope that you get to do what you say you will do as regards your health. All right, the checkup you said you'll do, please go ahead and do it this weekend. That headache that has been doing you this week, go ahead and have it checked. Okay, it's a weekend, so try as much as you can to have it checked. And that part of your body that has been giving you signals of pains, please try to deal with it, okay, so that you don't start a new week complaining of the same things that you've been complaining about. So please try to make sure that your health is well taken care of, because you can make money if your health is not up there. All right, my name is Rose Yusuf Kaiser. You're welcome to the program Radio Doctor. Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise right here on Your Women Radio. Radio Doctor comes to you Mondays through Friday, 10 to 11 a.m. I don't know why mine is going back to 8. But anyway, from 10 a.m. to 11 a.m. So yes, my name is Rose Yusuf Kaiser, and our radio doctor for today is Dr. Abiola Ajayi, the MD and the CEO of ROA Specialist Hospital. Good morning, Dr. Abiola Ajayi. How have you been? It's been some time.
Yes, it's been some time. So I'm doing fine. Thank you for having me.
All right. Thank you too for coming on. How are you faring? Last week we were told that you're not faring too good. I hope you're good.
I almost broke my ankle.
Oh.
So I was on crutches for a while, but glory be to God, today I'm walking without crutches, and
Hey.
I'll be fine in a week or so.
I'm so excited to hear this. You're in our thoughts, and we pray that everything will definitely be sorted out very much soon.
Thank you.
Thank you for coming on today. So, Dr. Abiola today is, like I said, he's the MD and CEO of ROA Specialist Hospital, and he'll be consulting and advising on sleep disorders and their impact on overall health and how to improve sleep. Now, whether we like it or not, sleep is important. Do you get, like, sleep is important? All those people that will tell you that if you sleep 8 hours a day, poverty will rush. If you do this one, poverty, you better forget those things and sleep. Oh, when you have the opportunity, sleep. If not, the sleep that you refuse to sleep, the sleep will stop you from making money. Do you understand where I'm going to? So please, today we're going to talk about all of it. Okay, so the phone lines will be open shortly, but in the meantime, send me a WhatsApp message. Okay, send us a WhatsApp message 070 317 56537. You can also send a message to 08155 917 917. So yeah, we're going to hear about the importance of sleep disorders, their impact on health, and how to improve sleep generally. That's what we'll be talking about today with Dr. Abiola Ajayi. All right, so it's 11 minutes past 10 right here on Your Women Radio, and this is the program Radio Doctor, your free health consultation program where real doctors advise real people. All right, Dr. Abiola, let's head on straight to the conversation this morning. Let's understand, when we say sleep disorders, what are these sleep disorders? And, how do they even get to impact our health? Because as long as, an average man is concerned or an average woman is concerned, he just knows, I cannot sleep. I don't know, I find it difficult to sleep. So they don't know that there's something called the sleep disorders, or, something might just be going on within them that's not giving them that room to have enough sleep. So what is sleep disorder, and what are the types of sleep disorders that we might have out there?
Yeah, so, a sleep disorder is anything that interrupts normal and natural sleep. Some of them are, some of the different ones are insomnia, which is difficulty falling asleep or maintaining sleep. Another one called sleep apnea. And another one that we call them under movement disorders is called restless leg syndrome. And there are others, but there's even some sleep issues where you sleep too much, right? But those are not as common as these three: insomnia, sleep apnea, and restless leg syndrome. I can see that often in the clinic, but they present in very different ways.
Okay.
Insomnia is the inability to fall asleep or stay asleep, and it affects up to 30% of Nigerians at some point in their life. In the U.S., it's about 35%. And sleep apnea is a serious condition where breathing repeatedly stops and starts during sleep. If you've ever slept next to somebody that has sleep apnea, you would know it could be frightening. I'll demonstrate it later. Because the patient themselves, the person that's sleeping themselves, often do not notice it, but they like pause. You feel them gasping for breath, and then they start snoring again. That's exactly how it goes. And it's often unnoticed by the patient, but it can lead to serious issues like heart issues, especially high blood pressure, and it's more common in overweight individuals. In Nigeria, it affects almost up to 20% of men and 10% of women. And those numbers are only going up in Nigeria because we have increasing obesity rates. So, when you have all that, there's a syndrome called Pickwinian syndrome. We have all this fat resting on your neck. It can help you. It can force you to snore and have sleep apnea. The final one, or the third most common one, restless leg syndrome, is an uncontrollable urge to move the legs, especially at night, which disrupts sleep. And about 10% of Americans complain about this. In Nigeria, I've seen it. We don't have statistics for that, but I've seen it in multiple of my patients, and it's real. You can't imagine that you just cannot control your legs, so they're just bouncing all over the place, and of course that can keep you from sleeping well.
Okay. It sounds new, to me. Yes, I've heard of insomnia, sleep apnea, but this restless leg syndrome, Dr. Bola, like you said, it's not common around here, but you've seen some patients with this. So, what actually brings about restless sleep, syndrome? Let's just understand that a little, because I'm sure maybe a lot of people might be dealing with it, but not knowing that that's the issue. Someone like me, I could actually move. I don't know, but I think I don't know. I think I move my legs a lot, and sometimes it feels as if from my waist down, maybe when I'm sleeping, it seems as if it's just too weak sometimes to move, and I find it hard to sleep. I don't even know when sleep just takes me away. With that. So I don't know if maybe that could be it, but sometimes there's just something about my legs that is not just right at sometimes when I want to sleep. So I don't know if this is it, because this is
the way to characterize restless leg syndrome is a brain disorder, it's a neurological disorder, and it's characterized by an uncomfortable. Most people say they have an uncomfortable feeling in their legs. It can be described as crawling, aching, tingling, even throbbing, and this sensation is usually accompanied by an irresistible urge to move the legs, which of course can interfere with sleep.
Now I get
and
it.
It's more likely to occur when a person is at rest or at night. It's rare that they have it during the day.
Okay, let's pick this call. Hello, good morning.
Hello.
Hi, good morning.
Not again with Pharaoh.
With who? This is Women Radio.
Hello.
Yes, I can hear you. What's your name? Where are you calling from?
Calling for Pharaoh.
All right. So I'm not sure this call is for us, but you can dial the number 07000 917 917. You can also dial 09155 917 917. Our toll free number is 0800 1235 917. It's totally free. You can dial that number and ask your questions as regards sleep. You're having difficulty sleep, because it's today I'm realizing that it's something restless leg syndrome, and it seems like that now waiting on they do me with that for some time, but we can definitely get to know further. Hello, good morning.
Good morning. Good morning. Thank you for Pharaoh.
No. This is a wrong call, I think. This is a wrong call. This is Women Radio. All right, so Dr. Biola, let's head on. This is your Women Radio WFM 91.7, and this is the program Radio Doctor. So do well to call in. Let's get to hear your questions, your concerns as regards sleep disorders and the impact on overall health. All right, so Dr. Biola has told us about insomnia, has told us about sleep apnea, has also talked to us about restless leg syndrome. Now, Dr. Abiola, how can, or rather, how can someone know um, if their loud snoring is a sign of serious disorder? Like sleep apnea. You mentioned that earlier, and you told us what sleep apnea is. So, how do we know that this is a serious sleep disorder? Because it almost feels as if those who get to snore when they sleep, they don't even know that they do it. And you, on the other side, who is close to them, might think, oh, this one is in a very deep sleep. But sometimes they wake up and they tell you, I just feel like I've not even slept at all.
You just hit
And you'll
the
be
nail on the
wondering,
head.
like, you'd have been snoring all night. What are you telling me? I beg, don't even say that.
That is what you just mentioned now is very, very important. I used to snore loudly before I now started exercising, lost weight, and changed my diet. But loud snoring on its own may just be an annoyance. But if it's accompanied by choking or gasping or breathing pauses during sleep, people breathe rhythmically. 1, 2, 3, 4, not 1, 2, 3, and then pause for a few seconds. So if you see any of those things, choking, gasping, or breathing pauses during sleep, that's a red flag for sleep apnea, and we call that obstructive sleep apnea. And then one of the first things I'll hear from the patient is not that I snore, because the patient may not hear. The wife may not tell me either because of what you just said. She thinks she's sleeping deeply.
Yeah.
But when people often feel excessively tired during the day or have morning headaches or difficulty concentrating, that's a gold star for obstructive sleep apnea. And it's because every time you have
Hi, Dr.
deep
Abiola.
sleep for
Okay.
hours, but each time you have that pause, that breathing, you come back up to like the lightest version of sleep and go back and forth, and you oftentimes will never feel rested, even though you're in the bed for 8 hours. So most people are unaware that this condition can lead to high blood pressure, stroke, and even sudden death in the in sleep. So, and this diagnosis by 80% of people that have it go undiagnosed. So it's often if your partner notices these signs, then it may be time for a sleep study.
Okay. Thank you very much, Doctor. Now, we have a question, but this is totally out of what we're talking about. Yes, this is from a lady who is pregnant and she just wants to understand, timings here. Now, she says, Good morning, Radio Doctor. I'm Stella from Lagos. My question is, at what weeks is third trimester? Because I'm confused. Some say it's 26 weeks, some say it is 28 weeks. Thank you. And that's her question. And I'm sure, Doctor, you agree that sometimes, what you're calculating is different from what the scan might tell you. And what some other people will tell you, oh, yeah, third trimester is starting from so week. Meanwhile, doctor is saying another thing, or the scan is saying something else. So I know it's outside what we're talking about today, but just help us to clarify this so that a lot of others who are listening would be able to know, the right timing for this. Hi, Doctor. Are you with us?
Now I can hear you. Can you hear me?
Yes, I can hear you loud and clear. So did you get the question, or do I go?
Yes, I heard the question. We're talking about third trimester.
Yes.
Right. So first trimester is 0 to 13 weeks. The second trimester is 14 to 27 weeks. And so the third trimester is 28 weeks to a birth. Right? Delivery usually occurs between 37 and 42 weeks, but the third trimester is from 28 weeks on. And during that third trimester, the reason why it's significant is that that's where the baby undergoes rapid growth, gains a lot of weight, and starts preparing for delivery. So that's why even in our third trimester, we start to monitor our antenatal visits more frequently. First trimester, we see the patient every month. But by the time we're in the third trimester, we see the patient every 1 to 2 weeks until delivery.
Okay. All right. Thank you very much, Doctor. So, Stella, I hope you're clear on that. Thank you for sending in your question. So, you can also do the same. Let's get to hear from you. 07000 917 917. You can also dial the number 09155 917 917. You can go ahead and dial our toll-free number 0800 1235 917. You can send us a WhatsApp message to 070 317 56537. And the other number for WhatsApp and text message is 08155 917 917. Okay, so doctor, we have another question here. All right, this is on menstrual flow. So I mean, anyway, so let's just take this here. This is coming from Esther from Ogba. Esther from Ogba says, for the past 2 months, I have been late seeing my menstrual flow. Is it normal, and what is causing it? So that's coming from Esther from Ogba. So for the past 2 months, her flow has been late. So she's just confused on what could be the issue.
All right. So it's I can answer that question, no problem, but it's important to know the age of the woman. So when a woman misses her period for 2 consecutive months, that's when we now give it a name called secondary amenorrhea. And it sounds like that's what she's having. The most common cause is pregnancy in women of reproductive age, right? But it can also, maybe you're not reproductive age or you're still in childbearing age, but you're not pregnant. Then there's something called PCOS, polycystic ovarian syndrome. This affects about 25% of Nigerian women of childbearing age, and it can cause irregular missed periods and amenorrhea or lack of menses. The final one I'll get into, there's a lot of causes, but I just want to go over the most common ones. If somebody's under stress, like excessive stress or emotional shock, it can also happen. For example, now some of these, I've mentioned this before, Olympic athletes training for, the sprinters, let's talk about the females. By the time they start doing their heavy training, a lot of them say they don't see their period for months until they now get back to somewhat of a normal schedule. So if your caller gives us a little bit more specifics, I can give even more causes, but those are the main ones.
Okay. All right. Thank you very much, Doctor. So Esther, if you're listening, just let us know how old you are so the doctor could actually maybe talk a little further and, to add to what he has said already. All right, thank you very much, Dr. Abiola. So this is 25 minutes after 10, and this is your Women Radio WFM 91.7, Nigeria's first radio station for women and their families. My name is Rose Yusuf Kaiser, and today I have Dr. Abiola Ajayi with me, joining me virtually this morning on the program Radio Doctor. He's the MD and CEO of ROA Specialist Hospital, and he's consulting and advising on sleep disorders and their impact on overall health and how to improve sleep. So do well to call in via the number 07000 917 917. You can also dial 09155 917 917. Our toll-free number is 0800 1235 917. You can also send a WhatsApp message to 07031756537. So those are the numbers to get in touch with us this morning. So let's go back to the conversation on sleep disorders and their impact on overall health. Now, doctor, so where does sleepwalking fall under? Is this a major sleep disorder? Sleepwalking rather, because that's something that we have seen children do, but I don't know if adults also get to sleepwalk. I'm not sure if I've seen that, maybe except in movies, but sleepwalking, where do we classify that? And what brings about that?
Yeah, so you're right about one thing. It happens more in children than adults. My daughter, when she's maybe 3 or 4, let's say, I would sometimes come out of my room to grab some water from the fridge. It's maybe 2 a.m. and I would just see her standing there. She's just standing there, not conscious, just standing there like sleeping. And she did that so many times. I was worried for some time, but it is a phenomenon. We also call it night waking, right? So if people wake up multiple times in the night,
Yeah.
at least over 3 times in the night, it can be classified as a sleep disorder. But the night walking or the sleepwalking really does. Now, what causes it? We're not exactly sure. Some think it could be hormonal imbalance or just part of different person's emotional response, but it does happen often. And usually you're not meant to, what I would do when I was here, I would just pick her up gently and put her back in bed. You're not meant to startle the person or try to wake them up or have them snap out of it. Just guide them back to bed.
Okay. All right. Thank you very much, doctor. So it's nothing to worry about, right?
No, it happens often.
Okay.
If especially in children, if they don't grow out of it, usually after 5, they've grown out of it. But
Okay.
if the child is still doing it up to age 10, then we may have to do some more tests.
All right. Hello. Good morning.
Hello, good morning.
Hi. Good morning.
Women FM.
Yes. Good morning to you. What's your name? Where are you calling from?
My name is Mr. Nicolas Olatibosun.
Hey, I'm sorry. I didn't
So
hear you.
I want to ask the first.
I said I'm sorry. I didn't hear your name.
Hi. I want to ask the provost. I want to ask your doctor. It was happened last 20 months. My face was marked with the technology. I don't know how they connected. Maybe I ate something that gave them the connection to my eye. They've been exploring my eye for 20 months. And this can cause a lot of tiredness and me. Up to the moment time, I have gone to the police 2 times to go and make a report. The police asked me to go to Ikoyi, PIA hospital for the tracking. But I want to have a doctor. Is there any medical or treatment which can cut off their network from my eye? Or what would I mean? How would I take good care of myself?
Okay. Doctor, did you hear his question? Because I'm not sure.
I didn't hear anything. I was hoping you were going to tell me.
Okay, I was just trying to understand because there's police issue coming in and all. All right, could you just go over that again, please?
You said, okay, hold on. Let me copy off the radio,
Okay,
then
great,
I will get it connected.
great. Okay, so hopefully he gets to call back again and then we get to hear because I was trying to understand it. He was talking about his eyes, talking about police case, something affecting his eyes. So I was just trying to understand, but hopefully he calls back and then we get to hear him much more better. All right, this is Your Women Radio WFM 91.7 and this is the program Radio Doctor. Hello, good morning.
Hello, good morning.
Hi, good morning. What's your name? Where are you calling from?
This is
This is who?
from Ogba. Esther from
Esther.
Ogba.
All right, Esther from Ogba. All right, Esther, go ahead. Let's hear you. Are you the same person that sent a message?
Yes, ma'am. Yeah, I want to tell you that the age.
Okay. Great. That's fine. Please go ahead.
Yes, I'm 19 years old and my menstrual flow, the dates I'm supposed to be seeing it, I don't used to see it. Maybe later, at the end of the month, I'll now see it. So I don't know what's causing it for the past 2 months now. It has been happening. And I don't know what's doing that.
Oh, okay. All right.
Are you under any
Ma, please, I want to ask
excess
another
stress?
question.
Just hold on, Esther. The doctor is asking you a question now. Go ahead, Dr. Abiola.
Yeah, are you under any excess stress, or have you gained or lost a lot of weight recently?
Sometimes I used to over, like, I'm always working, so sometimes I'm always stressed and tired.
Oh.
Okay. And any change in your weight? If you gained a lot of weight or lost a lot of weight recently?
No, I think I'm gaining weight.
Okay. All right. I'll answer her
All right, Esther.
question. She said she was 19, right?
Yeah, she said she's 19, but she said she has another question. So go ahead.
Okay.
Let's hear you.
In my head, it's always paining me inside my head, and when I spoke to my aunt about it, she said it's migraine, and they bought drugs for me. So anytime I don't eat, that thing always occur, and it pains the inside very much that I'll just be feeling lazy, like just lying down, not feeling like doing anything. And my head is paining me.
Your head or your eyes?
No, my head.
Your
inside
head.
Like my brain.
Oh, okay.
It's always paining me, and that pain is too much. I've taken drugs for it. They say it's migraine, but it's still doing me like that. Anytime I don't eat in the morning.
Oh, okay. All right, doctor, do you have any questions to maybe?
No, I think she said it when she doesn't eat in the morning, she feels very tired and has headaches.
Yes,
right?
yes. And
Okay.
all right, Esther, just keep listening, okay?
All right, so
Thank you,
Go ahead, doctor.
Yeah, we're talking about secondary amenorrhea, or the same thing as a woman missing her period for 2 months. So, number one cause, still pregnancy. Number two, it's polycystic ovarian syndrome. It just means that your ovaries have very small cysts in there, and they can cause hormonal imbalance and also keep you from menstruating or ovulating. And that can be diagnosed with an ultrasound scan. She mentioned that she's stressed significantly. Acute or chronic stress can lead to skipped cycles. Significant weight gain or underweight women can also have this issue. And then for her category, I would think about thyroid disorders as well as a hormone called prolactin. So if she takes the number, at the end and calls, we can walk her through some of these processes.
All right. No.
But that for a 19-year-old, that's what you should be looking at.
Okay. So I would make sure to call the number, so maybe she could call you for that for more. All right. So how about the head pain then? The headaches that she has, which her aunt says, is migraine, but it doesn't seem to be going anywhere, especially if she has not eaten.
Yeah, well, she said it's directly tied to not eating. When you don't eat, you can have low blood sugar, that's hypoglycemia, and that could cause headaches. Even her excess stress could cause headache. I think she used the word migraine. So that can also cause it. It could also cause you to have belly pain, which is like reflux or ulcer type pain. So ideally, you want to eat. You want to eat regularly. You want to keep your blood sugar in a normal range. And there are multiple ways to treat migraines. So I can't name medications on the radio, but if she calls, we'll talk around that. The other thing people should realize when you have headaches all the time, one, it could be a hormone for women, but it can also be visual, meaning maybe your glasses, or you need glasses, or your eyesight's not great, or you're always staring at a monitor. All of that can contribute to migraine headaches.
All right. Thank you so much, Dr. Abiola. All right, Esther. So just keep listening. I'll call out the numbers at the end of the show, and you can take any of them and get in touch with the doctor for more. All right. So this is your Women Radio WFM 91.7, and it's about 24 minutes to 11 on the side of the radio. And this is the program Radio Doctor, your free health consultation program where real doctors advise real people. All right. Let's try this call again. Hello. Good morning.
Hello, good morning, Radio Doctor.
Hi, good morning. You're welcome.
You're welcome, Olga. Thank you for picking my call.
Yes, you're welcome. I'm sorry, you said your name is?
Victoria, coming from
Victoria.
Oga.
All right, Victoria from Ogba. Please go ahead, Victoria. Let's hear you.
Well, I have two questions. One is related and one is not related. Can I?
Yes, please go ahead.
Okay. The doctor mentioned that sleepwalking when you asked me the question. So I wanted to ask now. I often wake up at night to drink water. Sometimes twice, sometimes twice. Is it okay or there's something I should look out for?
Okay, and what's the second question?
The second question is related to the menstrual cycle.
Okay.
It used to be 20 days before, but since the last 3 months, I've noticed from my calendar that it's no longer steady. Sometimes it's 30 days, sometimes it's 28, sometimes it's even 31. Is it okay? And I've not been doing anything stressful, just my regular routine, walk home. That's all.
Okay. All right, Victoria, keep listening. The doctor will definitely say something on it, okay? All right.
Thank you very much.
Thank you. All right, doctor, did you get her questions?
I'll need your help. I can't hear much
Okay.
of what they say.
All right, so Victoria from Ogba called and she asked two questions. Now, one is related to what we're talking about, and the other is on her menstrual cycle. Now, for the one related to sleep, she says she wakes up at night to drink water, sometimes 2 times, sometimes 3 times a night. Is that okay, or there's something more to that? And then the second one she asked was about her menstrual cycle. It usually is 28 days, but for some time now, sometimes it takes 30 days, sometimes even 31 days. She doesn't do anything stressful, just her regular routine that she does, go to work and come back. So she wants to know if it should be a thing of concern, because now the date is no longer consistent. It comes later than it usually comes. So she's a bit concerned on that.
Okay. Is she off the phone?
Yes, she is.
Okay. So the first one, talking about waking up 2 to 3 times at night to drink water is not usually normal, right? It's not usually normal. No, people usually sleep through the night, and if you're waking up, whether it's to drink water or to urinate, both of those could be an issue. So the number one cause is dehydration or dry mouth, right? If the person doesn't drink water during the day, but they live in a very dry or hot environment, or they're on certain medications, so like anti-allergy medications, they can cause dry mouth, dehydration. One that I see often, which is very common, is diabetes or impaired glucose tolerance. When you have issues with blood sugar, it can cause excessive thirst, which because your body is trying to use that water to remove the excess glucose. And then, she says she's not stressed, or anxious. Those things can also cause it. And then, if you are a kind of person that has poor sleep hygiene, you're going to hear me use that term a lot. Sleep hygiene, where you eat spicy or salty foods late at night, that's going to increase your thirst. If you're drinking alcohol or caffeine right before you go to bed, that can also worsen dehydration and disturb your sleep. So those are the main ones to check.
Okay. All right. And how about her period?
Yes, she said remind me what she said again.
All right. So her period are usually regular, 28 days. But for some time now of late, the dates are no longer regular. Sometimes it comes 30 days, or sometimes it does 31 days. So she doesn't know if it's something to worry about.
Yeah, it's a shift in your menstrual cycle from, most women are 28 days, but shifting to 30 to 31 days is not usually dangerous. It can, women's hormones fluctuate not only every month, but every day, right? So it's not usually an issue. Any menstrual cycle from 21 to 35 days, I can still consider normal, right? But if you now have a change, maybe you were a 28 weeker and you now change to 30 to 31. The most common cause is hormones that fluctuate. Some of these hormones like estrogen and progesterone. But if you have a cycle 21 to 35 days, I'm not really going to do much about it unless you're trying to get pregnant or unless you complain of headaches or discharge from your breasts. Then we'll know that's a hormonal issue.
Okay. All right. Thank you so much, Doctor. This is your Women Radio WFM 91.7, 18 minutes to 11. let's get to hear from you. What's the question or what's in your mind as regards to sleep disorders or any other thing the doctor can help you with this morning? Hello, good morning.
Hello, good morning to you, women radio doctor.
Hi, good morning. Good
I am the one that called. Yes, I am Mr. Nicholas. I call you from a Greek.
All right, this is better, Mr. Nicholas. Go ahead, let's hear you.
Oh, thank you very much. I think you can hear me very good and clear this time.
Yes, this is much better.
Okay. I said I have a kind of a trouble zone on my heart for the last 20 months.
20 months. Okay.
My eye, there are some people, I just saw them in my eye. They're using a kind of a Wi-Fi. It seems to be spying. So, and most of them asking me for money. And that's okay. If I should give you money, remove that. Most of them sending me number. Remove your network on my eye and I meet you somewhere, I send you money. No, they said no. But in most cases, they can use me very tired, and I have gone to the police station twice to inform the police. The police asked me to go to Ikoyi for CID for the tracking. So, but I do not have much time to currently because I have to monitor myself. Because I have to keep taking care of my family, and I did not go to work for the last 20 months that this thing just started with me. So I wanted to ask the doctor what part of the brain, maybe I ate something from the roadside that containing the little things that's getting the connections with those guys, or maybe I drink water that getting connections with the white of those guys. I just want to receive a good medical info from the doctor because I am planning to go back to Abiola because I'm a native, I am indigenous of Abiola. I reside in Abiola before I relocate to Lagos. But this thing happened to me in Lagos. So I wanted to go to Abiola. In the first sense, maybe I started from the doctor before I moved to the Elewe run for the tracking. But I want to ask the doctor what kind of the brain functions. Because in most cases, they can be like 25,000 symptoms on my brain, using my brain flatly, using me so very tired.
All right.
As I'm telling you now, they are there.
All right, Mr. Nicholas. So, thank you very much for calling. But I think what we'll do is to give out the numbers later to call because he's talking about his eyes, his brain, and, it's been connected to a Wi-Fi or something like that. So I can't, really put it together. Oh, doctor, did you understand?
No, I didn't hear.
Okay.
Help me again.
All right. So, myself, I'm trying to put what he's saying together, but I don't seem to understand because he's talking about his eyes, he's talking about his brain, he's also talking about eating roadside food that is affecting his brain, and he's also talking about him being able to see or be connected to some other people's Wi-Fi or something. So I think I'll just give your number at the end of the show, so maybe he can.
Yeah, I think I think that's better.
So that you have a one-on-one with him. I think that's much better.
Yeah, I could even invite him to do eye checkups here, and we sort him out. So that's fine.
Okay, great. So,
Yeah.
Mr. Nicholas, please keep listening. I'll reel out some numbers at the end of the show, which is just in a few minutes. Please just listen, and we'll definitely reel out the number so that you're able to use that to get in touch with the doctor directly. Okay, and if you will get to say one or two things on what you are going through. All right, so we just have a few minutes to go. You can dial the number 07000 917 917. You can also dial the number 09155 917 917. Our toll-free number is 0800 1235 917. Send us a WhatsApp message 0703 1756537. You can also send a WhatsApp message or text message to 08155 917 917. All right, doctor. So let's head back to the sleep disorders that we're looking at. Now, For somebody like Esther or Victoria who called and was talking about waking up in the night to drink water, I know that sometimes that could actually be, like you mentioned, diabetes could actually be playing somewhere, around for people who do that regularly. But keeping that aside, what of people who eat late at night? I know you've mentioned something like that, but I just want us to stress that because we have a lot of, in this country that we are in, sometimes before you come back from work and you're just trying to settle down, then you start preparing food at that moment, maybe by 7. And before the food is ready, you're looking at 9 p.m. or 9:30, and you need to eat that food before you go to bed. So, eating late, how does it affect your ability to sleep well? And then you have to wake up really early to get to work.
Yeah, eating late, especially heavy or spicy meals, can actually disturb your natural sleep cycle. So when you eat late, it triggers digestion when the body is supposed to be winding down. Digestion is like an exercise. A lot of blood gets rerouted to your stomach and your gut, and a lot of energy goes to that too. So when your body is supposed to be winding down, instead you have it digesting, which can lead to acid reflux, bloating, and so much discomfort that it will disturb your sleep. For example, in Nigeria, where we like to eat amala rice or things like that late, this can delay something called melatonin, and melatonin is the hormone that signals sleep for you. So oftentimes when I see these people, I'll even supplement their melatonin, and they improve. They improve significantly. Ideally, your last meal should be eaten 2 to 3 hours before bedtime. You don't eat and then jump into bed. But I know a lot of people do that.
True, a lot of people do it, and sometimes it's just when you talk to them, so what I go do now? I don't get choice. This is the time that. Well, anyway, I think we should be very cautious about that. Okay, so before we go, doctor, quickly advise us on alcohol intake. How does that affect us? Because we know that could actually affect a lot of our health, the different aspects of our health. Now, but how does that affect sleep? Alcohol, smoking, in fact, lifestyle in general.
Well, alcohol. Some people think it helps them fall asleep, and some people even think it improves sexual performance. All of those kind of things are just not true. Even though alcohol can make you fall asleep faster, it actually worsens the quality of your sleep. And you remember I talked about the deep sleep, which is called REM sleep. That's the deepest stage of rest. And when you drink alcohol before you go to sleep, it can lead to very fragmented and sleep that when you wake up, you don't feel refreshed. That's why many people after drinking, wake up feeling tired, even after sleeping for several hours. So it's not meant to be a sleep aid, and it can worsen insomnia, snoring, and even alcohol raises blood pressure, especially among men.
Okay. All right. Thank you very much, doctor. So let's have your final words on sleep disorders, how to improve sleep, all on what we've spoken about today.
Yeah. For many sleep disorders, we've talked about a few of them. It's not always drug, right? So when somebody has insomnia and they want to go to the chemist and just take a drug that makes them fall asleep, some of those drugs are addicting. And so a lot of the times you can just adjust your lifestyle. And that's what I've been preaching for a while for my patients. So maintain a regular sleep schedule, try to get between 7 and 9 hours of sleep in a day, limit your caffeine, exercise during the day, reduce your screen time at night. All of those things are lifestyle changes that can improve your sleep. If you do all of that and you're still having issues, then you need to see a medical professional. There's some things we can do to solve sleep apnea and chronic insomnia as well.
Okay. All right. Thank you so much, doctor, for taking our time to be with us today and to consult with us. We do appreciate all of your efforts towards our well-being. Thank you very much, doctor.
It's my pleasure.
All right. So do well to have a great weekend, as I'll reel out your information so that people like Mr. Nicholas can actually get in touch with you. Thank you.
Cheers.
All right. So, to get in touch with the doctor, so here are some of the details that could enable you get in touch with the doctor or the hospital itself. All right. So, you can go to the website www.theroahospital.com. www.theroahospital.com. So the THE is in small letter, ROA in capital letter, and then hospital in small letter.com. So www.theroahospital.com. Or you can dial the number 0913 579 5108. Okay? 0913 579 5108. You can also dial 0808 886 2635. 0808 886 2635. You can call that for an appointment and directions, all right, to get there. And then on social media, you can go to Facebook and Instagram at ROA Specialist Hospital. ROA Specialist Hospital, ROA in capital letter. On YouTube and Twitter, that's X, is ROA Hospital. All right, so those are the different channels you can get in touch with the hospital. So for Mr. Nicholas, I'm really concerned about, all of your complaints this morning. So I'll just give out the numbers once again so that I'm sure that you have them. 0913 579 5108. Okay? Or 0808 886 2635. Those are the hospital's numbers, okay? Call to get a direction to the hospital or get an appointment, okay? And you can go to their website, www.roahospital.com. All right, so this is where we wrap it up for today on the program Radio Doctor. Let's meet again on Monday, God's willing. We'll take you on different aspects of health. All right, so Mondays for children, Tuesdays for women, Wednesdays for general health, Thursday is for elderly health, Friday is on general health also. All right, so I appreciate each and every one of you who called in. Esther from Ogba, Victoria from Ogba, Mr. Nicholas from Ikorodu. Thank you so much for calling. And of course, to what's her name right now? I think from Esther too. Is this Esther? No, this Stella. Yes, Stella from Lagos, who sent in a message. Thank you very much for your messages. So do well to join us on Monday, God's willing, right here at 10 a.m. on Women Radio WFM 91.7. A very big thank you to our doctor for today for consulting and advising us this morning on the program Radio Doctor. So thank you so much, Dr. Abiola Ajayi, the MD and CEO of ROA Specialist Hospital, for consulting and advising on sleep disorders and their impact on overall health and how to improve sleep. My name is Rose Yusuf Kaiser. Do well to stay with us right here on your Women Radio. Coming up at 11 is Talk 'Am As You See 'Am.